Certainly, you can't continue a state of emergency perpetually. And so in our new normal, we do think that we're prepared.
Over at UC San Diego Health, Chief Medical Officer Dr. Chris Longhurst isn't forecasting a huge impact, with the state set to lift its emergency response next February. He says at one point there were over 500 emergency orders and waivers, and now there's just a couple dozen left.
I think it's really important to understand the federal state of emergency does continue. And it's under the federal state of emergency that things such as the Medi-Cal waiver and the telehealth waivers continue.
The state's top doctor says the threat of the virus is still real, but the once crisis situation is manageable. Longhurst says it's clear to him that we're moving to an endemic stage.
Which means this virus is going to be with us for a while. And people who are immunocompromised or elderly or otherwise at high risk should maintain that set of vigilance. For the rest of us, it's like the winter flu.
Locally, health officials say the announcement doesn't change what they're doing now. Vaccines and testing remain available. Public Health Officer Dr. Wilma Wooten expects the county to end its local state of emergency around the time as the state does. She points to low daily case counts.
Our numbers currently for this last week averaged around 230 to 250. Manageable, and that's getting better.
Health officials are preparing for some type of winter surge in COVID and flu cases. Wooten hopes it doesn't impact this February timeline.
Things might happen where the numbers might increase where that might not be possible. So we don't have a crystal ball. But that is the intention.
With the state of emergency eventually going away, the governor does want the legislature to do two things: continue allowing nurses to deliver COVID therapeutics and maintaining lab workers solely focused on testing efforts. Matt Hoffman, KPBS News.